Hey everybody, this is Dr. Nathan over at Body Balance Physical Therapy. Just making a video here to show you guys how to do our cat-cow exercise. I say our cat-cow, it's a very well-known exercise, especially in the rehab world, but we like to work on a couple of different nuances with it to talk to you guys about, and so that way you can see us doing it as well. So what we're gonna need for this is either the ground, or usually a pretty solid surface. If you want to do them in your bed, I'm okay with that, especially if it's more comfortable for your knees. We're not necessarily worried too much about loading through the knees on this exercise. It's much more of a lumbar and thoracic mobility and pelvic mobility exercise. But ideally, if we can get into a more solid surface, that's what we'd like. So what we're going to do, getting onto our hands and knees here. So anytime we're in a quadruped position or on our hands and knees, I want us to think about two things. Hands are directly underneath our shoulders. Knees are directly underneath our hips. Okay? So as we're doing this, what we're going to work on is we're just going to work on trying to, it's called a cat-cow, because we think about a cat, when it stretches its back, it really is trying to round its upper and its lumbar back, but we're also going to get some pelvic tucking into this exercise. So we're thinking about trying to tuck our pelvis underneath us as we push our lower back all the way up to the ceiling. So we actually are going to try to push through the heels of our hands as we go into this movement, keeping our elbows straight, and then we're going to go into the other portion of it, which is a cow. If you're thinking about a cow that has a really big arch through its back as it's kind of grazing. And so, but what we don't want to do is we don't want to bend our elbows and let our chest drop down. We want to try to think about dropping our belly button all the way down to the ground. So you can even start to add in a little bit of cervical extension with this to try to help with that. And that's going to help with some neural dynamic things as well. So we're just going back and forth in between these exercises. So as we come down, we can add a chin tuck as we push our back up. As we go down, we can stick it straight up in the air. Another thing that we can work on doing is trying not to necessarily tuck our pelvis and rock our pelvis as much, but really just try to drop that pelvis or that chest a little bit more, but then also trying to arch our back a little bit more without getting as much pelvic movement. Yeah, just that way we can start to get a little bit of unloaded motion through your spine. So if you have any questions, feel free to comment below. Ask us any questions that we can. We're here to help you. If you have any further questions or you feel like you need to come in or this movement hurts, in particular, if this movement hurts, it shouldn't. And so come on in and see us, and we'll try to get you all set up.